Well Within Reach is brought to you by Riverside MyChart, your simple, secure, and confidential online health connection. With just a click, Riverside MyChart lets you stay well connected to the same information your doctor sees. You can request prescription refills, pay your bills, schedule your next appointment, and more. Manage your care from your laptop, tablet, or phone. Whether for yourself, your kids, or the grandparents, MyChart makes your busy life just a little easier. Learn more and enroll today at riversidemychart.org. Just another way to stay well connected from Riverside Healthcare.
Riverside Healthcare puts the health and wellness information you need well within reach.
Today we are talking to Dr. Alex Herskovic. Dr. Herskovic is a radiation oncologist at the Riverside Cancer Institute. Doctor, welcome to the podcast.
Thanks. I'm happy to be here.
Now, let me start by asking a little bit about your background. Where are you originally from?
I'm originally from the Chicago area. I grew up in the western suburbs.
Which suburb?
LaGrange.
LaGrange. Did you go to LT?
No, that's where I would have gone. I actually went to a Catholic high school called Fenwick, which is in Oak Park.
Oh, Fenwick. Sure. Very good. I went to Downers North, and LT was in our conference, big rival. So I'm glad to hear you didn't go to LT.
Yeah, we weren't rivals. Yeah.
And then for schooling, where did you get your education?
So I completed my undergraduate degree at Duke University in North Carolina. I went to Northwestern in Chicago for medical school. I completed my residency training at Weill Cornell Medicine. So that's the Cornell University Medical Center, which is actually in New York City, not in Ithaca. And then I moved back to the Chicago area after residency.
Wow, very good. So you've been around the country, landed back in Kankakee and Bourbonnais, and we're glad for that. And Doctor, let me ask a little bit about why you chose radiation oncology. As a radiation oncologist, I get to be there for people in a very difficult time in their lives, and I find that to be very rewarding. A lot of my job is just to listen, and sometimes be a shoulder to cry on, but also try to give people a hopeful outlook, because there's a lot of great technology and a lot of great treatment we can do now. And radiation oncology sort of combines that human aspect of medicine with a lot of advanced technology that we can use to very accurately target tumors now while minimizing side effects from radiation therapy. Yeah, and that's specifically what we're going to talk about today, the Discovery RT system, which is something that does just that. Why don't you talk a little bit about what the Discovery RT system actually is?
Sure. So, I'm happy to have that new piece of equipment in our department. The Discovery RT system, the most important thing it does is it allows us to do a very accurate CT simulation. So the CT simulation is the first part of treatment planning for radiation therapy. Patients get a CT scan with this machine in our department, and we use special molds to allow patients to lay in a very reproducible position. And the Discovery RT system rebuilds the images that it takes for our radiation treatment planning software, and can give us a very accurate view of the tumor and allow us to design a plan that's as safe as possible.
Yeah. So as you said, being able to really pinpoint where that radiation is going during the treatment process really is a benefit to the patient.
Yeah, absolutely. And that's, all about what radiation oncology is about now is maximizing dose to the tumor and minimizing dose to surrounding healthy tissues as much as possible.
Yeah. Now, are all patients candidates for this system, or are there some patients with whom it does or doesn't work better?
Pretty much all patients in radiation oncology get a CT simulation as part of their treatment planning now. There are a few situations, for example, for small skin cancers, where, you can see the tumor with your eyes. It's a skin cancer, so we don't necessarily do a CT simulation for that. But I would say 99% of our patients would get a CT simulation with the Discovery RT system if they're seen in our department.
Now, the benefit of really pinpointing and not impacting the healthy tissue and organs around the where the site of the cancer is, that's the primary benefit. Are there additional benefits of the RT system? Yeah, so it has some other more advanced features than that all prior equipment had. So it's a wide bore CT scan. Pretty simple concept, but it's a wider opening in the CT scanner, which not only is more comfortable for the patient, but allows us to do radiation setups where we can really minimize those beams passing through normal tissue. So, I'm particularly excited that this Discovery RT system allows me to offer prone breast radiotherapy for more of our breast cancer patients, which really, really helps us to reduce radiation dose to the heart and lungs, which in the past was more of a problem in radiation oncology, but it's something we can really minimize now.
Wow, that sounds like a huge benefit. Keeping radiation away from the vital organs. And although I'm not a doctor, I know the heart is indeed a vital organ.
Yeah, it's a pretty important one.
Even marketing guys know that's the case.
Yeah.
And the idea of collaboration in oncology is probably an important one. I know you've got a great team there at the Riverside Cancer Institute, but the collaboration between you and the other providers is something that's an important part of the patient's care journey, isn't it?
Yeah, absolutely. Cancer care by definition is really multidisciplinary. There's three main ways to treat cancer: surgery, radiation, chemotherapy. There's a separate doctor for each. And the chemotherapy doctors and medical oncologists, they work right around the corner from me, so I can touch base with them on a daily basis on all of our patients.
Oh. Now, Doctor, you haven't been out of school all that long, but I think it's interesting that you're already able to see some new technology that's coming in from the time you started your schooling to now being a couple years in practice. Have you seen indications that there are constant advancements that are going to be happening in cancer care?
Yeah, absolutely. That's one of the things I neglected to mention that drew me to oncology is it's something that always changes. It's really an important battle to fight, and radiation oncology is about being at the cutting edge of that and really offering patients translating technology to the best cancer care possible.
Yeah, I've had the pleasure of being able to hear Dr. Sapahi speak, one of the other oncologists there at the Institute. He's had a long, wonderful career in oncology, and he talks about just how amazing the technology and all around oncology care has advanced over the course of his career, and I'm sure he's excited to see someone like you come in and get those same advantages to see where cancer care is headed.
Yeah, and Dr. Sapahi is a great oncologist. I think all the medical oncologists here are great. I'm happy to work with them, and they give me a great example for me to follow in my own practice.
Yeah, that's great to hear. Now, just to recap about the Discovery RT system again, this system, which is in use at the Riverside Cancer Institute, really gives you an opportunity to focus that cancer treatment on the site and not affect healthy tissue and organs around. That's really the key to this new technology.
Yeah, absolutely. That really helps us to maximize patient outcomes.
And Doctor, folks want to learn more about all that you have to offer there. Where can they go?
So they can go to our website, which is riversidehealthcare.org/cancer, or they can call us at our general oncology number. Can reach all of our oncology providers that way. The number there is 815-933-9660.
Very good. Well, Doctor, thank you for all the information you shared.